All right, hello everybody, Dr. Goforth here again. Today I'm going to be briefly going over how exercising before having your baby can help recovery afterwards. Just make it faster, less painful, easier in general. So, and what I mean by that, whether it's literally before you're pregnant and during pregnancy, better afterwards. Those of you who now realize you're pregnant or you're a little bit further, a lot of doctors tell their patients if they ran before pregnancy that it's pretty much okay. Just double check that with them. But even if you haven't done, you don't need to run, but some type of exercising, even if you haven't done it pre-pregnancy, is really helpful. There are lots of great resources. I know especially in Asheville, or at least there was pre-COVID, and there's different resources I'm sure you can find online. But a couple of things that I usually recommend is some type of modified Pilates or yoga class. If you live somewhere, maybe here at Asheville, where there's a class offered, some of them now, if they're not totally open back up, some of them are offering like outdoor spaced out classes. But I would just double check that they're more focused on pregnant women, so that they're going to modify and show you different things. Yoga is great because they're going to focus on your posture a lot and just different movements of your pelvis, stretching, strengthening, and again, all that help making that tissue as healthy as possible. It's going to make it easier. Pilates is another great one. From a strength perspective, especially in coordination, especially when it comes to pushing. If you end up having a vaginal delivery, the more coordinated you are at all the different muscles, pelvic floor, especially abdominal muscles, when it comes time to push, if you know how to push and breathe well, that's going to be really helpful. And then just to break it down a step further, if you don't do those classes, or within those classes, you want something specific to really focus on, Kegels, if you don't know how to do them, go see a pelvic health specialist. Diaphragmatic, or what I like to call belly breathing, is really great. It's really simple, just thinking about your belly expanding on your inhale and belly collapsing on your exhale. And you can get more detailed and more specific than that, but that's to keep it simple. Those are two really great exercises to do. As a precaution, though, if you're noticing some yellow flags like constipation, painful intercourse, don't do a bunch of Kegels. Go get checked out by a pelvic health therapist first. If that rings a bell with you, your muscles might be a little too tight, and that could be something helpful to have worked on leading up to delivery day. So those are the biggies. Just thinking about some type of strengthening, stretching, breathing, in general, some type of coordination practice before pregnancy and during pregnancy can help make that process so much better afterwards. You could apply the same thing to any type of surgery. The healthier the tissue is, you're just going to recover faster. So that's our short and sweet video for today on recovery after pregnancy. Take home, exercise. Have a great day, guys.